Welcome to OST 149 Cyber Safety Lesson 3, Cyber Threats in Public Health and the Workplace, brought to you by the Nighthawk Cyber Alliance. The first two lessons covered your legal responsibilities and how electronic health records get attacked. This lesson zooms out to look at the broader environment: public health systems, workplace culture, vendor relationships, remote work, and the organizational frameworks that govern how healthcare cybersecurity is structured. By the end of this lesson, you will understand how cyber threats operate across the full healthcare workplace and what your specific role is in keeping that environment secure. Healthcare workplaces are attractive targets because of what they hold: patient records, financial data, and research information that cybercriminals find highly valuable on black markets. In 2024 alone, U.S. health systems faced 386 documented cyber attacks, with ransomware directly threatening patient lives and care delivery. Most breaches originate from workplace vulnerabilities. Phishing emails, weak passwords, and unsecured devices are the most common entry points. That means the workplace itself is where most attacks begin, and every employee plays a critical role in organizational security through vigilance, training compliance, and proper incident reporting. Public health agencies collect and manage population-level health data, including disease registries, vaccination records, and outbreak surveillance systems, all of which require strict legal protections. Under HIPAA, cyber attacks on public health systems can cripple disease surveillance capabilities, delay outbreak response, and compromise the accuracy of epidemiological data that public safety decisions depend on. Public health practitioners must implement the same administrative, physical, and technical controls required of clinical settings to maintain data integrity and confidentiality. Healthcare practitioners also have legal obligations to report certain health conditions to public health authorities, and those reporting systems must maintain cybersecurity standards to protect the sensitive patient information they carry. The National Institute of Standards and Technology, NIST, cybersecurity framework is the gold standard for healthcare cybersecurity practices nationwide. While it is voluntary rather than legally mandated, it has been widely adopted because it provides a flexible, risk-based structure that maps directly onto HIPAA requirements. The Department of Health and Human Services actively references NIST standards in its cybersecurity guidance for healthcare organizations. And as we covered in Lesson 1, documented adherence to the NIST framework provides safe harbor protections under the 2021 HIPAA Safe Harbor Law, reducing penalties and demonstrating due diligence when breaches are investigated. The NIST framework is built around 5 core functions that together form a complete approach to cybersecurity: identify, understand the assets, risks, and vulnerabilities in your systems; protect, implement safeguards to limit the impact of potential incidents, which parallels clinical risk assessment in healthcare settings; detect, identify cybersecurity events through continuous monitoring, because timely detection directly minimizes breach damage and exposure; respond, take action to contain and mitigate incidents once they are identified; and recover, restore capabilities and services after an attack, which links directly to business continuity and patient safety. These 5 functions work as a cycle, not a checklist, and every healthcare organization is expected to have practices in place across all 5. The Department of Health and Human Services has published cybersecurity performance goals, known as CPGs, that divide security requirements into 2 tiers. Essential CPGs are the core security measures required for all healthcare organizations. These include multi-factor authentication, data encryption at rest and in transit, email security protocols, security awareness training, unique credentials per user, and timely access revocation. Enhanced CPGs represent advanced measures for mature security programs. Things like comprehensive asset inventory, third-party vulnerability disclosure, network segmentation, continuous monitoring, and regular penetration testing. Essential CPGs are the HIPAA compliance baseline. Enhanced CPGs are aligned with the NIST framework and are expected to become mandatory compliance standards in the near future. Social engineering attacks target the workplace specifically because human vulnerabilities are easier to exploit than technical ones. Four tactics show up repeatedly in healthcare environments. Pretexting involves attackers creating fabricated scenarios, posing as IT support, executives, or vendors to manipulate employees into revealing sensitive information or credentials. Baiting uses malicious USB drives or downloads left in common areas to trick curious employees into unknowingly installing malware. Tailgating occurs when unauthorized individuals follow authorized employees through secure doors, exploiting workplace courtesy to gain physical access to restricted areas. And human vulnerabilities more broadly, the instinct to trust, to be helpful, and to respond to urgency are exactly what social engineers count on. Workplace culture that prioritizes customer service can inadvertently create security gaps when employees bypass protocols to assist others. Business email compromise, BEC, is the single most expensive cybercrime category in the United States. The FBI reports that BEC caused $2.9 billion in losses in 2024 alone, with attackers impersonating executives and vendors to redirect payments and steal funds. BEC attacks target finance and billing departments by posing as trusted contacts to manipulate employees into authorizing wire transfers, invoice payments, or credential sharing. Healthcare organizations are at particularly high risk because medical billing departments manage large financial transactions and maintain extensive vendor relationships, both of which are exactly what BEC attackers look for. A single convincing email from someone who appears to be a supervisor or known vendor can result in hundreds of thousands of dollars transferred to an attacker's account. HIPAA mandates written security policies that are regularly reviewed, updated, and tested to ensure effectiveness. These policies are not background documents. They are legal instruments that define what employees are required to do and what the consequences are for non-compliance. Proposed 2025 updates include stricter testing protocols and more frequent policy reviews to address evolving threats. Policies must be communicated through training, and employees who complete that training face stronger legal accountability for any violations that occur afterward. Trained employees who violate documented policies can face termination, civil liability, and potential criminal charges. Ignorance is not a defense once training has been completed and policies have been acknowledged. When employees leave an organization, failing to properly revoke their access credentials creates significant and ongoing security vulnerabilities. Former employees with active credentials represent a serious insider threat. Disgruntled ex-employees may steal data, sabotage systems, or sell access to cybercriminals, and post-separation breaches caused by lingering credentials are a documented and growing threat category. Immediate access termination is an essential cybersecurity performance goal under HHS guidelines. Organizations must disable all user accounts, badges, VPN access, and system permissions within 24 hours of separation to prevent unauthorized access to protected health information. Proper offboarding is not an HR formality. It is a critical security control. Every vendor or contractor who has access to PHI extends your organization's security perimeter and extends its legal exposure. HIPAA requires formal business associate agreements with all vendors handling PHI, establishing security obligations and breach responsibilities in writing. Proposed 2025 rules would mandate annual written verification that vendors are actually maintaining the required security safeguards, not just signing the agreement and moving on. Organizations remain legally responsible for breaches caused by third-party vendors with PHI access, which means vendor access must be actively monitored, limited to what is necessary, and subject to regular security assessments and incident response protocols. Network segmentation is the practice of dividing a network into isolated sections to contain breaches and limit how far an attacker can move once inside. It is listed as an enhanced cybersecurity performance goal and is one of the most effective structural defenses against ransomware. The Ascension Health breach in 2024 demonstrated exactly what happens without it. Ransomware spread rapidly across connected systems because there were no effective barriers to contain it, disrupting patient care across 142 hospitals. Best practice requires isolating clinical systems, administrative networks, and guest Wi-Fi from each other so that a compromise in one section cannot contaminate the others. Zero Trust is a security philosophy built on one core principle. No user, device, or system should be automatically trusted, regardless of whether they are inside or outside the network perimeter. Every access request must be verified through authentication and authorization before access to any resource or data is granted. Users receive only the minimum access necessary for their specific task or session, reducing the potential damage from any compromised account. Zero Trust principles align directly with HIPAA's minimum necessary standard and are included in HHS Enhanced Cybersecurity Performance Goals for healthcare organizations. In practical terms, Zero Trust means that being logged in does not mean being trusted. Every action is evaluated. Bring your own device, BYOD. Policies allow employees to use personal phones, tablets, and laptops to access work systems. In healthcare, that convenience comes with serious legal weight. Any personal device that handles PHI must comply with HIPAA security requirements regardless of who owns it. Personal devices accessing patient data must use encryption, multi-factor authentication, and secure access controls. BYOD breaches carry the same legal and reporting obligations as breaches on employer-owned systems. The device being personal does not reduce the organization's compliance exposure, and employees are personally responsible for securing their devices, with termination or legal action as potential consequences for violations. Remote work and telehealth have permanently expanded the healthcare workplace beyond the physical building. And the same HIPAA privacy and security requirements apply regardless of where care is delivered or where work is performed. All remote access to patient data and clinical systems must use VPNs to create encrypted tunnels that protect data in transit from interception. Telehealth sessions must use HIPAA-compliant platforms that include business associate agreements, access controls, and audit logging capabilities. All telehealth communications require end-to-end encryption. Location does not reduce compliance obligations or legal liability. Working from home does not create a legal exception. HIPAA requires security awareness training for all workforce members handling PHI, including employees, volunteers, and contractors. This is a legal mandate, not an optional professional development opportunity. When policies or procedures change, updated training is required to keep staff current. Well-documented training programs do more than meet compliance requirements. They can reduce enforcement penalties and demonstrate organizational due diligence during OCR audits. The bottom line on training is this: it is not optional. It protects both the organization and patients from preventable security incidents, and the documentation of that training is evidence that matters when investigations occur. When a breach involves public health data, disease registries, vaccination databases, outbreak surveillance systems, the reporting requirements become more complex and more urgent than a standard HIPAA breach. These incidents trigger overlapping notification duties to HHS, state agencies, affected individuals, and potentially the media. Reporting is mandatory regardless of breach scale. Even small incidents affecting public health data must be documented and reported promptly. And public health breaches require coordinated response between IT security, legal counsel, public health officials, and communications teams. The interconnected nature of public health data means a single breach can compromise population level decision making, which is why the reporting obligations are so extensive. HIPAA does not cover everything. The Federal Trade Commission's Health Breach Notification Rule fills the gap by extending breach notification requirements to health apps and consumer health technology that fall outside HIPAA's scope. This covers fitness tracking apps, mental health platforms, period tracking apps, and wearable health devices that collect personal health information, but are not covered by traditional HIPAA regulations. Healthcare workers have a professional obligation to understand FTC rules when recommending or using consumer health apps with patients, because knowing which regulations apply protects both patients and practitioners. Vendors of non-HIPAA health apps must notify consumers within 60 days of a breach, and FTC enforcement actions can result in significant fines. Employment and vendor contracts in healthcare include binding cybersecurity obligations, and every healthcare employee should understand those clauses before signing. When you sign an employment contract with security provisions, you are legally accountable for compliance with those terms from day one. Violating contractual security obligations can result in termination, civil liability, and legal action entirely separate from any HIPAA enforcement. This is why reading and understanding the cybersecurity sections of your employment and vendor contracts is not optional. Those clauses define your specific obligations and the consequences for falling short of them. HIPAA includes strong anti-retaliation provisions that protect employees who report cybersecurity breaches or security concerns in good faith. Federal law prohibits employers from demoting, terminating, or harassing employees for reporting violations to supervisors, compliance officers, or regulators. Healthcare workers have both a legal obligation and legal protection when it comes to reporting. It is a professional duty and a protected activity simultaneously. Failure to report a known security problem can result in personal liability. Documentation of good faith reporting is essential. It is your evidence that you fulfilled your obligation and that any subsequent retaliation was unlawful. Employers in healthcare have legal authority to monitor all activity on work-issued devices, including computers, phones, and tablets, covering email, browsing history, file access, and application usage without requiring employee consent. When employees use personal devices for work, monitoring becomes legally complex. State privacy laws may restrict employer access to personal device data, creating tension between the organization's security needs and employee privacy rights. Several states, including California, Connecticut, Delaware, and New York, require employers to notify employees about electronic monitoring practices. Healthcare organizations must balance legitimate security monitoring with employee privacy expectations through clear written policies, employee acknowledgement, and consistent enforcement. A cybersecurity incident is a workplace emergency and should be treated with the same urgency as a physical emergency, because in healthcare, it often is one. The first 60 minutes after a cyber incident are the most critical window for evidence preservation, breach containment, and limiting damage spread. Every second of delayed response allows attackers to move further through the network, encrypt more data, or exfiltrate more records. Improper or slow employee response significantly worsens organizational legal liability and regulatory penalties. When you suspect an incident, report it immediately. Do not investigate it yourself, do not wait to be sure, and do not assume someone else will handle it. Cyber liability insurance has become an increasingly standard part of healthcare risk management, covering breach response costs, regulatory fines, ransomware payments, and business interruption losses. Insurers require documented risk analysis, MFA implementation, workforce training, and incident response plans before issuing policies, which means organizations that want coverage must already be doing the fundamental security work. One important point for individual employees: organizational cyber insurance does not protect you personally from liability for negligent or intentional violations. The organization's policy covers the organization. Your professional exposure from a deliberate or negligent security failure remains entirely your own. HIPAA requires organizations to designate a security officer with clear authority, direct access to leadership, and the resources needed to implement security measures effectively. But security is not just the security officer's responsibility. It is a leadership issue at every level. The OCR evaluates leadership engagement during breach investigations, and organizations with documented executive involvement in cybersecurity demonstrate compliance commitment that can result in reduced penalties. Organizations where security is not treated as a board-level concern face higher fines and stricter scrutiny during compliance audits. Executives who fail to prioritize cybersecurity may face personal liability and reputational damage following major breaches. The HHS cybersecurity performance goals translate directly into three categories of daily behavior that every healthcare worker is responsible for. First, unique credentials. Use unique passwords for every system and account. Lock your workstation when stepping away, even briefly, and verify identity before sharing any sensitive information. Second, training and awareness. Complete all required security training on schedule, stay current on policy updates and new threats, and apply what you learn to your actual daily work habits. Third, report suspicious activity. Report phishing emails and suspicious messages immediately. Alert IT to unusual system behavior or access attempts, and understand that every employee action directly impacts the organization's overall security posture. Public health practitioners carry expanded cybersecurity responsibility beyond what individual clinical workers face. Because the data they protect is population level, a breach of public health systems can disrupt disease surveillance, delay outbreak response, and compromise the health data of entire communities, not just individual patients. Breaches in public health settings also erode public trust in health institutions, reducing participation in vital programs like vaccination campaigns and disease reporting, which creates downstream harm that extends well beyond the incident itself. Cybersecurity is now recognized as an essential professional competency for all public health professionals, not just the IT specialists who maintain the systems. The regulatory environment for healthcare cybersecurity is changing faster than at any point in the industry's history. The 2025 HIPAA security rule updates are moving all security standards from addressable to mandatory, meaning organizations can no longer selectively implement safeguards based on their own judgment about what is reasonable. Potential new CMS requirements could tie cybersecurity compliance directly to Medicare and Medicaid participation, meaning providers may need to demonstrate security standards just to receive federal reimbursement. Penalties for noncompliance will increase as regulations mature, and security requirements will continue evolving throughout your career. Continuous education and adaptation to new frameworks and regulations is not optional. It is a career-long professional obligation. Lesson 3 has covered the full scope of cyber threats in the public health and workplace environment. The core takeaways are these. Cybersecurity is both a legal and professional obligation for every healthcare worker, not just IT staff. Public health systems, vendors, remote work environments, and BYOD each present unique vulnerabilities that require specific safeguards. The NIST and HHS frameworks exist because past breaches cause real harm to real patients and organizations, and those frameworks encode hard-won lessons about what works. And your daily actions, locking screens, verifying identities, reporting threats, completing training, directly impact your organization's security posture in ways that matter. That brings us to the end of OST 149 Cyber Safety Lesson 3, Cyber Threats in Public Health and the Workplace, brought to you by the Nighthawk Cyber Alliance. In this lesson, you covered why healthcare workplaces are targets, public health reporting obligations, the NIST framework and its 5 functions, HHS cybersecurity performance goals, social engineering tactics, business email compromise, workplace policies, employee offboarding, vendor risk, network segmentation, zero trust, BYOD, remote work and telehealth, workforce training, breach reporting, the FTC health breach, notification rule, contracts, whistleblower protections, workplace monitoring, incident response, cyber insurance, leadership accountability, and the evolving regulatory landscape. You are now better equipped to protect sensitive health data and contribute to a secure workplace environment. We will see you in Lesson 4.